If you're in healthcare and you're interested in improving health outcomes, which I think most people are, then why wouldn't you want to think about all the ways to improve health outcomes? All the things you can do to make lives better for the patients you serve, for the people in your community that you serve, for the reason to get up in the morning and do the work that you're excited about doing. Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping decision makers and leaders navigate change with clarity. In viral healthcare, we explore the trends spreading across healthcare and how to implement them sustainably and wisely. So today's reflection is about an interview that I did with Rich Rasmussen earlier this week. Rich is the president and CEO of the Oklahoma Hospital Association, an organization that supports 153 hospitals and health systems, along with physician organizations, clinics, and other services all throughout Oklahoma. And Rich has been doing this for 36 years. I know, he started when he was age 3, if you watched him on the video. But it's interesting to think about how Rich's idea about taking this idea of looking at health outcomes with a bigger lens, with a lens that says, yeah, we have to do what's right within the healthcare system, but we have to look outside of the healthcare system, how we might make it better. And Rich talked about a couple of examples where that might happen. Transportation. He talked about during COVID, the hospital was the only source of food because there was no Safeway in some, or no grocery stores, sorry, Safeway, you're not the only one out there, no grocery stores in some rural communities. How if they want to think about virtual healthcare and telehealth and telestroke services, how bandwidth and these things that are outside the usual concerns of hospitals, health systems, physicians, and others in the healthcare system, how they're really critical to really improving outcomes. We often call these social drivers of health, but it also has to do with the availability of healthcare services, the preventive healthcare that's gone on in a community. How do we actually understand what those are and try to identify them to improve health outcomes? And we have been working with Rich and his team in Oklahoma to create the Oklahoma Healthy Oklahoma Profile. It's a way of looking at both zip codes and hospital service areas and other regions throughout the country to identify the high opportunity area, where the gaps are the greatest relative to all of the possible things we could work on outside of the health system to improve health outcomes. Where should we focus in this specific community? We often call it a thumbprint on exactly where the gaps are. And Rich and his hospital association are committed to improving those gaps, addressing them in a very collaborative way. So you'll notice if you go back, and I really urge you to go back and watch that video or listen to the podcast with Rich. He is amazing in his thoughts about how we have to do more, we have to do better, but we have to be really precise because our limited resources, limited times, and we have to prioritize. And building this tool, the HOP tool, the OK HOP tool, is a way to help that prioritization, to really refine what's needed specifically in different areas of Oklahoma, both in the rural and urban areas. And if we use that tool, to create the priorities map, then we'll be able to be much more effective more quickly and have a bigger impact on health outcomes. And this is at the time when hospital and others are facing cuts in Medicaid and other funding sources, where they're trying to keep their financial heads above water. And yet there's a way to collaborate both in the private sector and in the public sector to make a difference. But it really begins with understanding what are the big high leverage points to be able to do it and where they exist. And that's the purpose for the tool. So Rich is kind of building off of this trend of looking at social drivers of health, or looking at healthcare capabilities outside of the health system. He's building on this trend of let's find alternative ways to provide healthcare, like virtual healthcare, like wearables, all of the things that are, people are exploring in depth right now that we're going to be implementing over the next 5 to 10 years. And how can we leverage that to be more effective at improving healthcare? And how can we do it with the least amount of resources, with the least amount of difficulty, and with the fastest turnaround time? So it was a great interview. It was an honor of me to be able to host him and to be able to ask those questions. I learned a ton from Rich. And more importantly, I learned how a real leader thinks more strategically, more globally, more interconnected as a system of components, and not just this is my turf, that is your turf, and we have to fight for keeping our own pieces of the pie. That's the old way of thinking. That's the kind of, you know, rear view mirror thinking about the future and how we're going to drive healthcare improvements in our communities and the people we serve. Rich's ideas and the way he's trying to utilize a tool like the HOP is exactly what we need in the country. And he talked about what others should think about across the country as they try to do these things, or maybe they want to avoid them, but they need to do these things in their own communities. I urge you to come back and look at it. And there's really a call to action. The call to action is, how do we think more globally? How do we think more broadly? How do we say, I'm not just going to stay in my swim lane because the pool is splashing on edges, and I've got to be more effective in my swim lane, I've got to address everything going on around me in the pool and outside the pool, and how we're dealing with all of these systems. It's all connected, and Rich gives you a great pathway on how to think about going it further. So I want to thank Rich Rasmussen and his work in the Oklahoma Hospital Association for their interview, and I'm so grateful that you get the opportunity to hear them. If you like this subject and you want to share it with a friend who's implementing an innovation or idea or platform, or dealing with this idea of health outcomes larger than the day-to-day operations of a hospital or clinic or physician's office, then share this episode, share this reflection with them so they can learn more. I'm Bruce Spurlock, and I'm looking forward to seeing you the next time.